Was there a time when you were asked to perform an autopsy on Jessica Goebel from Aberdeen?
Yes, sir. We conducted the autopsy on January 13th, 2015 at 0900 hours.
How did it come about you were requested to do that autopsy?
We received a request from Michael Carlson, the Brown County Coroner, asking us to conduct the autopsy.
Prior to conducting your autopsy, what background information were you provided?
We were informed that she had been found unresponsive in her residence with multiple apparent sharp force injuries. She was transported to a hospital where, despite medical therapy, she died several days after the discovery time.
Is it standard operating procedure for you to receive background information such as that?
Yes. Part of doing forensic pathology is we're a form of medicine. So just like when you go see your physician, he asks you for information about what brought you in that day. He uses that information to help make his diagnosis. We do the same. We gather information, what happened to the individual prior to coming to us, and we use that to help us make our diagnoses as well.
Did it appear to you that Ms. Goebel had sustained some injuries?
Yes, sir.
Can you generally describe Ms. Goebel's injuries?
Yes, sir. Looking at Ms. Goebel, first there was medical therapy because she had been in the hospital. There was evidence of tissue donation as well. And then looking beyond the medical therapy, looking beyond the tissue donation, there was evidence of surgical intervention as well. In addition to that, we noticed that there were multiple injuries that had been stapled closed. Looking at those, we felt that the injuries consisted of stab wounds and incised wounds. A stab wound is a sharp force injury that is deeper into the body than it is longer on the surface. An incised wound is longer on the surface than it is deeper in the body. The same weapon can create both wounds. It's just a matter of how much penetration there is into the body. And looking at Ms. Goebel, we noticed both types of injuries scattered through multiple aspects of her body throughout. Internally looking, we were able to see that a lot of those injuries, actually 5 of those injuries penetrated and affected organs. And then there was another 4 that penetrated the body but didn't affect internal organs. And then there were multiple that were simply superficial, only involving the skin and soft tissues of the body.
Dr. Snell, did you reach a conclusion as to the cause of Jessica Goebel's death?
Yes, sir.
What is that opinion?
Multiple stab and incised wounds.
Did you likewise come to a conclusion as far as the manner of Jessica Goebel's death?
Yes, sir.
What is that opinion?
Homicide.